Hi, and welcome to the Husch Blackwell mini webinar series. This is our second webinar of 2020, and today we're going to discuss the coronavirus, or COVID-19, and some of the legal considerations that pharmacists and pharmacies might want to be thinking about as this virus continues to spread. And as always, I'm joined by my colleague, Wakaba Tessier, from our Husch Blackwell, Kansas City office. And Wakaba and I really wanted to talk about this issue because we've been getting a lot of client questions regarding what clients need to do in order to get ready for all of these changes that might come as the virus continues to spread. So thanks for being here, Wakaba.
Sure. Thanks, Erica. I'm happy to be here. So as everybody knows, the COVID-19, it's a fluid situation. We get breaking news every single day. So obviously this isn't going to cover all of the issues probably associated with the spread of this virus. But we wanted to introduce issues to you that we've preliminarily identified and that we thought might be helpful to you as you begin preparations.
So as an overview of some of those issues might include possible supply chain issues, reporting issues related to patient encounters, how to prepare your organization, some internal considerations for what you might need to do, and then also some external considerations about how to prepare your organization. So that generally is what we're going to be talking about. So as I mentioned, we're going to start off by talking about supply chain issues. And Wakaba, can you explain to us what supply chain issues we're talking about and what you can do to kind of avoid some of those issues?
Sure. So one of the first things I thought about was a specialty pharmacy client that we work with that dispenses specialty drugs that have to be kept at a certain temperature. So in order to do that, they have these ice packs and cold packs that were specifically designed for this particular product. And my thought went to, okay, because of COVID ID, somehow the shipping and distribution of those ice packs and cold packs were disrupted, then what happens? So those are the types of things that I think pharmacies, especially specialty pharmacies that do ship these types of drugs, need to start thinking about. What is essential for dispensing these products? What is essential to pack these products? And so the first thing that I would do is to pull the applicable contracts, and maybe it is that you get all the contracts out to the extent you don't have a lot of them, and start reviewing those for things that you think will really impact your business should supply chain issues arise.
So like the contracts with your vendors?
Exactly. And one of the clauses that I would pay particular attention to is called the force majeure clause, and that's really a clause that covers acts of God. So if one of the parties can't perform because of a quote-unquote act of God, then that will appear in a force majeure clause. Now, a force majeure clause will have instances of, like an earthquake or war. Those are sometimes things that you see in there. So you should pull that out and look at it. It's obviously easier to enforce these clauses if the actual event is listed in there. But you might see words like epidemic or illness or, frustration of the provision of services due to a government action, things like that. So those are probably the key buzzwords that you want to be looking for when you pull those agreements out.
So as a pharmacy, what would I want to see in there if it was, let's say, my vendor who was supplying my cold packs and I couldn't get them?
Yeah, so you're going to need to look at what is going to allow the vendor to tell you that we have a right to not be able to supply you these products.
That makes sense.
Right? Like what provision can they rely on to say, I'm really sorry, we can't get you these products? I mean, obviously at the end of the day, if they can't do it, they can't do it, right? Because of an unusual circumstance. But to the extent that you want to enforce these provisions, I think it's going to be really important for you to be prepared and to know what it actually says in these provisions.
That makes sense. And so let's say for some reason, obviously you can't get the cold packs and so you can't distribute things to your customers, and then your customers are suing you because they can't get what they need. Is there anything to protect you against that?
Sure. So one of the things I think about is disruption of business, right? In a few webinars ago, we talked about insurance and how it's really important to get the right kind of insurance for your business. And in that context, we were talking about compounding pharmacies and being prepared for, fungal or bacterial introduction into your compounding process. But here we're talking about a very different sort of situation where we're facing an epidemic and in a spread of the disease. So what you're going to want to do is pull out your insurance policy and see if, in the event that there is a disruption of business because of COVID-19, see if your insurance will cover for that disruption of business and your disruption of revenue.
That makes sense, because obviously you're going to want to keep paying your staff even though...
Exactly.
Maybe.
So can you recoup that loss that you might experience as a result of COVID-19? So in our last webinar series, we talked about how the scope of practice for pharmacists is expanding. And in some cases, they are probably the healthcare provider with whom we have the most contact, simply because it's so easy to go see them, right? You walk down to your neighborhood Walgreens, you walk down to your neighborhood CVS, or whatever local pharmacy it may be, to talk about how you're feeling and what medications you can have. So I do think that pharmacists who are on the front line of providing care may have some unique issues related to COVID ID. So what are your thoughts on that, Erica?
Exactly. So pharmacists are going to have a lot more patient encounters because it's so much easier, like you mentioned, for patients to see them rather than getting an appointment with your primary care doctor or waiting in an urgent care where people are coughing on you and you're having to sit in a waiting room for 5 hours. Not that all urgent cares are like that, but you know. And so for that reason, it's important for pharmacists to be aware of the reporting obligations. And these are going to be a lot of times reporting obligations under state law because health and public wellness in the Constitution is delegated as a state power. So a lot of times that's why you're going to look to state law to see what these reporting and containment issues are. So by statute, 48 states require reporting clusters of illness and outbreaks for public health significance immediately or within 24 hours of identification. And then by statute, 13 jurisdictions have already reacted and require reporting for suspected or confirmed cases of any novel coronavirus to the health department immediately or within 24 hours of identification. And so those are statutes. But by memo, 47 states and DC require reporting of all the COVID-19 to the health department immediately. And so I say suspected or confirmed cases. Obviously, if you're a pharmacist, you're probably not going to know which cases are confirmed.
And I guess if they are confirmed, right, supposedly you're coordinating with the hospital or wherever that first line of care was given. And so they would have reported that.
Exactly. And hopefully the people are undertaking that self-imposed quarantine like they should be and not just wandering around your pharmacy, which also might be an issue.
Right.
So if there is a confirmed case, it's important to know, first of all, what you need to report and then who to report it to. So that brings up an issue that a lot of our clients deal with regularly, which is HIPAA. And so when are you allowed to report these cases?
So there is an exception under HIPAA for these types of issues, right? So a covered entity may use or disclose protected health information to a public health authority that is authorized by law to collect or receive such information for the purpose of preventing or controlling disease, which in this case we're talking about COVID-19. And so, but the key I think here is authorized by law, right? So the authorization by law here that Erica is talking about were those memos and statutes that obligate you to report cases of confirmed or suspected COVID-19 cases to the health department.
That makes sense. So let's say I'm a pharmacist and Jeff comes in and he tells me that he has the coronavirus. And I know that Jeff is the neighbor of one of my friends. Let's call her Karen.
Mm-hmm.
Am I authorized to go tell Karen, hey, maybe you should stay away from Jeff?
So based on what we just talked about in the HIPAA exception, right? Like I said, that the key word here was authorized by law. And I don't, sure, maybe telling Karen is, trying to prevent or control a disease, but you were never authorized by law to tell Karen. What the law authorizes, and here we're taking the example of the state laws that Erica was just talking about, but what you are authorized to do is to report those to the health department. And really, it's the health department's then job to go and, try to get Jeff to go back to his home or inform Karen that hey, you might have COVID-19. So that's something to just keep in mind. And as a pharmacist, that is really on the front line of providing care.
So obviously no one wants the situation where Jeff is walking around your pharmacy with the coronavirus, coughing on things. But the question is, what can we do now, right, if that does happen, to prevent the spread, and what legally are the obligations, and what should we be putting in place right now before that happens? And so some things that organizations, especially pharmacies, are going to want to consider is having the necessary policies and procedures in place for emergency preparedness and keeping your staff in place. So what are you going to do if, let's say, one staff member comes down with the virus? How are you going to replace them? And then in that same token, you're going to want to run this plan by your human resources department, if you have one, to make sure that you're complying with all the necessary employment laws like FMLA and the Americans with Disabilities Act and the Fair Labor Standards and Exemptions Act. So there's a lot of employment considerations you're going to want to just make sure that you have taken care of. And then also, you're going to want to make sure from a compliance perspective that you are good to go and you're not going to have any issues with surveyors. And so, Wakaba, I know that you've dealt with these issues in the past with other organizations. So what do you think that people need to be aware of?
Right. So one of the things that came to mind, and actually CMS probably had the same idea I did, because on March 4th, they just announced that they were taking several actions aimed at limiting the spread of the novel coronavirus. And one of the things that they're doing is whenever they have a state surveyor, right, come in and inspect your facility. And by the way, this goes for accredited organizations too. So if your pharmacy is accredited by URAC or HCA or any other accrediting joint commission, any of those, this will be applicable, is that they're going to look for what you have done to limit the possible spread of the infection. So they're going to look at your infection policies and procedures, and they're going to pay particular attention to what areas have you been non-compliant in the past related to the health and safety of the services that you provide. One of the things that I think might happen too, and especially with compounding pharmacies, if you've had an inspection before and there was some deficiency that was found with respect to sterility, and obviously we're talking about two different things, right? But there may be some more higher scrutiny placed on those sterile activities that you do with respect to compounding. They're probably going to look for infection control policies and procedures, or what are your practices on a day-to-day basis. So that's something to keep in mind. The other thing too to keep in mind is that you might have vendors coming in and out of your facility. So again, I'm thinking of the situation where we had a specialty pharmacy that had the packaged products, but there was a huge loading dock in the back, and they opened up the loading dock, and the drivers are loading all of these drugs into their trucks, their UPS or USPS trucks or whatever it was, and so you might want to start thinking about requiring vendors to certify that personnel coming on site haven't recently traveled to any of the countries that the CDC deems as high risk for the coronavirus. So essentially what it is that if you have regularly people coming in and out of your facility, you want to make sure to, and for the ones that you can control, right? So like for a closed pharmacy, like a specialty pharmacy, it's probably going to be easier to control that. For a community pharmacy, like Jeff's situation, it's going to be a lot harder. But to the extent you have vendors that come in on a regular basis, you might want to start requiring them to disclose information that may be pertinent to trying to contain COVID-19 infection.
And that brings up another policy regarding your employees that you might want to have in place as well. Not that there is a vaccination right now for it, but should one become available, employers might also want to think about having a mandatory vaccination policy in place. I know a lot of hospitals have that already. Nursing homes in a lot of states are required to have that. But pharmacies might also want to think about requiring their technicians to have certain vaccinations as well. So now that we've talked about some of the internal considerations, we want to shift and talk about some of the external considerations you're going to need to think about. So obviously, as a healthcare provider, it's extremely important to protect your patients. And part of that, especially with this coronavirus, is knowing who your patient population is exactly. So for example, if your pharmacy is located really close to an assisted living facility and you have an elderly patient population who might be more at risk for certain reasons, or if you, let's say, do home delivery to an assisted living facility or nursing home, you're going to need to take special precautions. So in the case that we just talked about where you're delivering medications, you might want to make sure that your delivery driver,
is healthy.
Exactly. And if they're not, that might be the first person that you say, okay, you don't have to come to work today.
Yeah, exactly. I think the other things to start thinking about, and this is obviously worst case scenario, so hopefully this doesn't happen, but in the event that you do need to shut your operations down for a period of time, you might want to start thinking about is shutting down your facility a patient abandonment issue? Will there be patient complaints related to unprofessional conduct if you can't fulfill, your obligations and dispense the drugs as you normally would be able to? So, you might want to start thinking about that. I will say that from a federal perspective, there is a law that grants HHS an authority to waive certain requirements for providers to follow conditions of participation in certain Medicare rules during national emergencies. And so, at the federal level, there is that. Check your state and local statutes as well, because there may be something like that. And in cases of these emergencies, it's hard for me to imagine that your state board of pharmacy is going to come in and discipline you because you had to shut down your operations. But, it's good to start thinking about these things. And really, one of those things that you want to start thinking about is how to handle the questions from your patients from a PR perspective. How are you going to notify your patients? Do you have another pharmacy that you can refer those patients to? Things like that. So those are some good things to consider as a doomsday scenario, I guess.
And as these emergency situations develop, like you were talking about, a lot of states also can enact certain legislation or make certain concessions that wouldn't normally be made. So, for example, during the H1N1 situation a few years ago, they allowed licensure reciprocity and expanded scope of practice, especially for pharmacists, because like we mentioned before, you're on the front lines and you're seeing the most patients. So it's important to also be aware of what's going on in the news and what maybe some expanded abilities that you have are to deal with this.
And I think your professional associations that you belong to is probably going to be a great resource, right? It's already a built-in network of your peers. See what they're doing. See if they have any preparedness issues when it comes to patient communication. And start a discussion there, because I think those discussions are going to be what's going to best prepare you for this possible epidemic.
That makes sense.
Thank you for listening to our webinar. Obviously, as I said at the outset, this is a really fluid situation. So if there are areas that we didn't cover that you'd like us to cover, please let us know. One other thing I'd like to mention is that we might have the opportunity, right, Erica, to launch this as a podcast. So we'll be continuing to do these series, and maybe we'll do a webinar and a podcast.